Mom's been diagnosed with dementia. Now what do we do? Every family with a loved one who's been diagnosed with dementia will have a host of questions, including this one. So we've tailored this presentation to those family members who are new to caregiving for a loved one with memory issues. And these tips are intended to share our expertise with you so that you can be better prepared for what lies ahead. So what is the diagnosis? It's an important question. Is it Alzheimer's? Is it Parkinson's? Is it Lewy body or perhaps frontal lobe dementia? These all have specific symptoms and progressions, and you need to educate yourself and your family so that you're prepared and can begin planning. So after the diagnosis has been given, it's important to pay attention to what the doctor recommends for treatment. Now, this treatment could include some new medications and possibly some clinical trials. And these recommendations will provide the basis for the planning that is yet to come. Now, it's important to note that dementia cannot be cured, but it can be managed with a good plan and the right medications. So let's talk about these medications. Any new medications need to be integrated into the daily routine because medications can and will help control symptoms and behaviors. People with memory loss can forget to take their medications. Compliance is a big issue here. So please make sure your loved one is taking these medications at both the proper times and the proper doses. Furthermore, make sure your doctor is aware of all medications your loved one is taking so that there are no dangerous interactions. Eating properly is so important for all of us, especially for those taking medications because these medicines need to be metabolized properly. So in short, make sure your loved one is eating enough. Now let's talk about tracking behaviors and why we do it. Identify the behaviors that you're seeing. This helps with care planning. Keep a behavior log so that you can begin to anticipate the daily ups and downs. So what is a behavior log? A behavior log can be comprised of notes in a journal or Google Docs, for example. But it's most helpful if the notes are kept for an extended period of time so you can begin to establish behavior patterns. Now, all family members should be able to contribute to this log for a couple of reasons. One, a shared record allows everyone to participate in mom's care and no one feels left out. And two, a well-kept history shows patterns of behavior. Let's talk about the stigma associated with dementia. Because unlike cancer or other diseases of the body, dementia is a disease of the mind. Sometimes, family members of loved ones with dementia might find themselves ashamed of the behavior associated with the dementia because it's causing changes in personality. So accepting your loved one for who they are and where they are in their disease process, it's so vitally important. Because it's not the person who has the behavior, it's the disease that's causing the behavior. Keeping your circle of family and friends informed about the disease and its progression can promote empathy and understanding for everyone involved. And now we come to planning and why it is so crucial. Begin to name the people in your loved one's support group and start to establish roles for them. And this needs to be as detailed as possible. Who will be in charge of her finances? Who will do her shopping? Who will do her cleaning? Who will take her to her doctor's appointments, and so on and so on and so on. Now be very clear and transparent about available assets, including the financial resources, because this clarity can prevent possible discord in your family and it helps you plan for the future care. Continuing to educate yourself about dementia is so important. There are lots of resources available to you, both online and in person. You need to ask for help too. You as caregivers need to take the best possible care of yourselves. Did you know that 40 to 70% of caregivers have clinical symptoms of depression? And a caregiver's immune system can be affected for up to 3 years after the end of caregiving duties. Those are some heavy numbers. So locate and engage therapists who specialize in aging issues. And certainly, seek out organizations like the Alzheimer's Association and the Parkinson's Foundation. They maintain a wealth of resources for you. Now let's talk about the benefits of care planning. Timing is important. Inform yourself about outside help as soon as possible because dementia progresses at different rates. Families who have a solid plan of care in place, you'll see less caregiver burnout. Also, having a plan in place allows for easier transitions to either in-home care or a long-term care facility. You don't want to be the one who calls and says, "I wish I would have called you 6 months ago." We as professionals see the best outcomes from families who have planned early and planned well. And finally, make the most of the good days. Because with the diagnosis of dementia, your loved one will experience good and bad days. Just because you experience a bad day does not mean all days will be bad, though. The symptoms of dementia are really a series of behaviors that change frequently. So don't get stuck when there's an undesirable behavior. Caregivers who focus on their own well-being create more good days for themselves and their loved one. And finally, be sure to enjoy the good days with your loved one because life is so precious. Thank you.